Hello there. Today, I'm going to guide you through the steps of performing a breast self-exam right at home. Knowing how to do this properly is crucial for your health, so let's dive in. First things first, choose a day just after your menstrual period ends, as this is when your breasts are least likely to be swollen or tender, making it easier to feel for anything unusual. Step 1. Start by standing in front of a mirror with your shoulders straight and your hands on your hips. Look at your breasts for any changes in size, shape, or symmetry. Don't forget to check for any dimpling, puckering, or changes in the skin or nipples. Now raise your arms above your head and look for the same changes. It might feel a bit like a stretch, but it's an important perspective for seeing changes. Step 2 involves feeling your breasts while lying down. Place a pillow under your right shoulder and put your right arm behind your head. Using your left hand, gently move your fingers around your right breast in a circular motion from the outside to the center. Be sure to cover the entire breast from your collarbone to the top of your abdomen and from your armpit to your cleavage. Switch sides and repeat this process with your left breast. It's key to use different levels of pressure to feel all the breast tissue. Light pressure is perfect for the tissue close to the skin, medium pressure for a little deeper, and firm pressure for the tissue close to the chest and ribs. For the final step, stand or sit up to feel your breasts. Many women find that the easiest way to feel their breasts is when their skin is wet and slippery, so they do this step in the shower. Move your fingers in the same circular motion described earlier, covering all parts of your breast. Remember, if you feel any lumps, thickening, or hardened knots, don't panic. Many of these are not cancerous, but it is incredibly important to see a healthcare provider to have them evaluated. That's all there is to performing a breast self-exam. Doing this regularly can be a lifesaver. And remember, a self-exam is not a replacement for mammograms or professional checkups, but it's a great habit that keeps you in tune with your body. Stay healthy and take care.